Next thing we're going to talk about is the 3 mistakes that people make regarding their core. Let's start with this. What is the core? Okay, you may see an infomercial where typically what happens is they'll have a doctor on, and the product will be something for strengthening your abdominals, so your six-pack muscles. They'll show a male and female model with these amazing six-pack abdominals, and the doctor will say something along the lines of, by the way, if you suffer from lower back pain, if you use our Ab Roller 2000 Plus or whatever the name of that product is, then there's a good chance your lower back pain will go away, because everybody knows that when we strengthen our stomach muscles and we strengthen our core, back pain decreases. Well, that's not completely true, and let's cover why that isn't completely true. So number one, the first mistake that most people make in strengthening their core is they think of the six-pack muscles. It's called rectus abdominis. You never have to remember that, but the muscles that you can see. So rectus abdominis and obliques. That has nothing to do with what is your real core, okay? And it has nothing to do with your lower back muscles. So they train the wrong muscles. Okay, so what are the right muscles? Well, if you take a look at your pelvis and your lower back, you do have a core. And if you peel those abdominal muscles away in your imagination that you're training when you're doing crunches, or when you're doing like an oblique movement, or when you're using a machine at the gym to strengthen your abdomen, which is the wrong thing to do. If you peel those muscles away that you're using when you do those exercises, there's a deeper abdominal muscle. Okay, it's called transverse abdominis. I'll never ask you to repeat that, but it's called transverse abdominis, and it works very much like a stability belt. So have you ever gone to UPS or FedEx, or seen a postal worker or somebody at Home Depot, or somebody who lifts a lot, they wear those stability belts? Well, you have one of those naturally in your body, and if you learn how to use it, that is strengthening your core. That'll make you more stable, and that is what leads to less back pain. So it's not crunches or obliques that strengthen. In a few seconds here, we're going to get to what exercises do strengthen at the best. Okay, so that's training the wrong muscles is the first mistake. The second mistake is when people are doing abdominal exercises, they tend to bear down or hold their breath. So you have something called your diaphragm, which when you breathe is what moves up and down, okay, and what causes your lungs to expand, get bigger, and also contract and get smaller. Okay, so what a lot of people will do is when they're training their abdomen, or when they're training what they believe to be their core, is they'll bear down. So they'll, that has nothing to do with your core muscles, but it is a common mistake. So right now, as I'm standing here, I can contract my abdominal muscles, specifically that transverse abdominis. I can make my lower back muscles tight, which gives me that nice support feeling, but yet I can breathe at the same time and freely talk to you. That is what you want to learn how to do if you're training your core muscles. So if you do begin doing core exercises, you want to make sure that you're freely breathing and you're able to talk while you're doing those exercises, not the not bearing down as you're doing that. So that is the second mistake. The third mistake is this, finding the right exercise to do, and also misdiagnosis. So the best exercises for strengthening your core are planks, okay? And frequently what we'll see when we see somebody with a chronic hamstring strain, chronic quad strain, where they frequently injure their groin muscle repeatedly, or another type injury maybe involving the hip flexor, every time that we see that, usually that person has a weak core. They might be an absolutely amazing athlete. So they might be a weekend warrior, or they might be an amazing athlete, or they might be quite sedentary. But every time that we see that, hey, here's a muscle that attaches to the pelvis, and if the core is strong enough, the muscle should be working fine, or should be healing. Every time that we see that and there's a little blip or a little red flag that something's not quite right, usually they're training the wrong muscles, They may be bearing down, or they may not know how to use their core muscles. And successful treatment involves screening out the pelvis, taking a look at that, and in a second here we're going to talk about finding the best hands-on PT in your area to do that. But usually there's an underlying pelvic problem and there's an underlying core weakness problem. So the best possible exercise that you can do is a side plank. And if you go to our YouTube channel, Madden PT Official, and you look up top 3 exercises for core stability, we'll have 1 or 2 exercises on there that show how to strengthen your core. The top 2 exercises are a side plank and a prone plank, are the best proven exercises through research to strengthen your core muscles. Now, we talked about when somebody has chronic strains, the hamstring attaches to the pelvis, the hip flexor attaches to the pelvis, piriformis attaches to the pelvis, quadricep attaches to your pelvis, right? And your groin muscles attached to your pelvis. So anytime we see somebody with a chronic strain, the first thing we do is screen the pelvis out and make sure that it's moving the way that it's supposed to. If it's not, if the pelvis is not moving the way that it's supposed to, what we need to do as hands-on physical therapist is get the pelvis moving the way that it's supposed to. Then we go and strengthen the core muscles so that that person doesn't need the hands-on care over and over and over again, and they're not re-injuring their groin, their quad, their hip flexor, or their hamstring again. Now, how do you find the best hands-on PT in your area if you're not here in central Pennsylvania? You get on the phone to call to schedule, and if you're in New Zealand or Australia or Ireland or anywhere in Europe or India or Canada, and you call the physiotherapist to schedule an appointment, you ask this question: does your therapist routinely do a grade 5 lumbo-pelvic mobilization? So does your physiotherapist normally routinely do a grade 5 lumbo-pelvic mobilization? If they say no, if they're hesitant, if they stutter, once they ask the physical therapist, you need to schedule an appointment elsewhere. Research and surveys show that about 10% of all physical therapists countrywide and worldwide do the type of therapy that you need to do to get you to a point where you're not having those chronic problems and where you're getting permanent relief for your lower back pain or your chronic strain. So that's how to find the best hands-on PT in your area if you're not here in central Pennsylvania. Also, the one thing that I want to end on here is keep a lookout for an offer in the next few days that you're going to receive from me via email for a free report on core stability and core strengthening. So keep an eye out for that.